One result of this ongoing pandemic is a spike in plastic surgeries that many are calling the Zoom boom. Dr. Richard Chaffoo is joining us now with the very latest. Dr. Chaffoo, good morning. Good to see you.
Good morning, Shally. Great seeing you.
I think I can answer part of this question, this uptick in cosmetic procedures. I've noticed even when I go out and some people are wearing the mask, I can see the bandages under their face, which is
exactly right.
Which is a great time to do it.
It's the perfect time. You're right, Shally. I mean, I think part of this is as physicians, we're seeing more and more patients actually, by Zoom or by remote because some people are just not comfortable coming in. Obviously, we're practicing, keeping the waiting room empty. And so I think more people now, Shally, are used to telemedicine, both physicians and patients. I think it's better access. And, we're all spending our time on, Zoom calls, a lot of time in front of computer screens. We're noticing some of our imperfections. Sometimes, unfortunately, even the computer screens will sort of distort things. Oh. And I think also we're, now with the vaccines, as the last segment showed us, we're seeing a light at the end of the tunnel. We know that we're going to get past this pandemic. And so people are thinking, well, gosh, I have the downtime right now. And it looks like we're going to get on the other side of this pandemic. So let me spend some time now because I'm not at work. I'm sheltering in place. I'm probably not going on vacation. And I have some more disposable income, and I want to do something that makes me feel better about myself, rewarding myself for going through this experience that we've all been suffering with over the year.
Because maybe for some, Dr. Chaffoo, in the past, it's been finding the time of when am I going to get that 2 weeks to be able to recover, and there are people who can work from home and recover at the same time.
Exactly. In fact, it's not even the 2 weeks. I mean, because it's now literally it's gone into months. So I'm finding in my practice, and I'm sure a lot of my colleagues are, that patients are doing more multiple procedures where the recovery may be a bit longer simply because they do have that prolonged downtime, something that you usually have to plan for, take vacation time. So this has been ideal time for many patients.
What are the top procedures that people are asking you about right now?
So I think right now, Shally, that what they're asking about most are things that we're all seeing in the Zoom. So eyelid surgery called blepharoplasty is a very common thing I'm seeing patients for. Rhinoplasty, as you said, covering the face with a mask. You saw a number of people that had bandages on from that. And then hair restoration. I have a large hair restoration practice for both men and women. So anything involving the face, but other procedures, mommy makeovers where it's a longer recovery for breast, tummy procedures. That's another time where people are really thinking this is an ideal time to get that work completed.
Are people still taking advantage of the Botoxes, the fillers?
Yes, they are. I mean, I'd say the top non-surgical procedures in this Zoom boom we're seeing are Botox, the lines in the forehead, the mid-face, fillers around the face, the mouth, the lips, and then laser rejuvenation, from sun damage, lines in the face, or pigmentary changes. So both an uptick in the surgical and the non-surgical portions of the practice.
Many elective procedures right now, maybe not recommended because of the hospital capacity. So are these surgeries still happening? Is there a safe way to be able to do this and people don't have to feel afraid about going to the hospital?
That's a great question. So absolutely. I mean, the most important thing for patients to understand that as physicians, we're very aware of this pandemic, and we take all kinds of precautions. Our hospital here at Scripps Hospital, I'm on the campus. I mean, you can't even get into the professional building unless you have your temperature checked. We're all taking the precautions of wearing a mask. There's no waiting in the waiting areas. We don't have patients crowding the office. And before any procedure is performed, the patients and staff are always checked for COVID. And then where we're doing these procedures more and more now is in outpatient surgery centers, freestanding facilities that are not part of the hospital. So patients are not really getting exposed to people that have COVID-19. So it's very safe.
Dr. Chaffoo, always good to see you. It's not, I mean, we'll be doing this for a few more months, so if anybody wants to do it,
right.
There you go.
It's the time, right?
It's the time. Thank you, Dr. Chaffoo.